Paula Nutting, your musculoskeletal specialist. Do you have clients and patients that come in to see you that have recurring tightness in those upper cervical muscles, especially the ones along attached near the skull? We call them our suboccipital muscles, and they're the ones that our patients will say, these are the muscles that are really, really tight, and it doesn't matter what I do, nothing seems to relieve them long term. We can do a lot of work as neuromuscular techniques, we can do muscle energy techniques, we can do glides, we can do joint capsule mobilizing. But this is something that's a little bit more global and something that I found in the clinic that has got a little bit more lasting length with the client and patient. First thing, let's do some assessments on 𝐒𝐮𝐻. We're going to look at her upper cervical range of movement. So I'm going to get you to chuck that chin out forward for me, and we look to see how much range she's got here. So that's actually extension of the upper cervicals, and then she's going to come back and we're looking at our flexion. So we need to see good quality, nice length, and there's not a lot there. Go forward again for me, 𝐒𝐮𝐻. She's actually tilting up more than being able to come purely forward and back. And we know that we need to have good range so the eyes can sit at the horizon, otherwise we have postural anomalies that we'll get going on with our patients. Because we're doing something global, I also want to see how her flexion looks in seated. So can you go forward for me? So we're going to curl down. And I'm looking at the quality. She's got beautiful quality of her thoracic spine. But when we come down to this lumbar area, can you see how it's quite flat here? Where are you feeling that?
Right here.
Okay, so she's got it just along the gutter on the right-hand side of all the way down the lumbar vertebra. Let me show you how I've been getting great results with it. The first thing we need to do is, again, do some passive assessment of the cervical movement. So I want to actually teach 𝐒𝐮𝐻 that I'm after some movement like this. So we're trying to get your chin to create double chins. Perfect. And when we go through this range, that you want to feel that your head's driving down to the table and your neck feels like it's going to be flatter near the pillow. I'm going to get you to bend your knees and put your feet flat. What we're asking her to do is create a bridging move. So she's going to engage the gluteus maximus. She's going to get those big power driver buttocks muscles to bring her hips and pelvis off the ground, and she's rotating and creating more flexion through the thoracic and lumbar vertebra whilst I do a traction. So I'm tractioning her up first. We're increasing the drag along the whole, yes please, paravertebral erector spinae group, and she's up in that position, squeezing those glutes for 5, 4, 3, 2, 1, and then she's rolling down bone by bone, starting with the thoracics and then going down to lumbar, and I'm taking the pressure off the skull. So I'm going to traction in again, pulling in as she rolls up. Really feel those glutes engaging. Squeeze nice and firm. I would say we're even getting some lovely stretches all the way down that thecal area and coming down. So all those lovely craniosacral therapists, this might be a wonderful, you might be able to explain it a little bit better through that line than I. And up we come again. Keep that head down as low as it can towards the pillow. For 5, 4, 3, 2, 1, and down we go. How did that feel?
Good.
Yeah, not too hard to do? Great, excellent. Let's have a retest and see what her neck and her lumbar ranges are like. 𝐒𝐮𝐻, I'm going to get you to go through that chin forward position for me again, and then chin back. And forward. So that actually looks like it's starting to get a bit better glide. How's that feeling to you?
Better.
Yeah. Okay. Originally she was complaining that she had some tightness up on this top right. Has that eased off a bit?
Mm-hmm.
Great. Excellent. That's good news. Let's have a look at her seated flexion. Oh wow. Yeah, okay, so can you see the curve change now? That was flat from here to here before. You can do a rewind on this to take a look, but that curve here is beautiful and that's great as well. How's that drag in here?
It feels a lot better.
Yeah.
Less pull.
Okay, so we haven't cleared it completely in 3 moves, but we certainly recognise that there's a problem. You can come up now. We certainly recognise that there's a problem all the way from the neck and down through the spine. Use this for any clients that have that chronic tightness up through here, and I dare say anyone who's got lower back problems, that you might be able to do this to assist with lower back by acknowledging that we can work on the skull as well. I'm Paula Nutting, your musculoskeletal specialist.